whenever I see a patient who's open about their recovery, we'll have some very candid conversations, because fear is a big trigger for relapse. And we want to make sure that they're comfortable. And I always tell patients, some of the treatment we're going to do may cause pain, and that pain will be manageable, but it pales in comparison to the pain of opening up an active addiction again. I tell them, that the biggest cause of tooth loss is tobacco use. You're here because you want to maintain your teeth for the rest of your life, and this is a big risk factor. And so how are you doing with that? And I always say then the next thing I say is the best way to quit is to keep trying to quit.
Any kind of substance use is a mental disorder or an illness. It's not so simple as the person just not drinking or not smoking or not using. Typically, when they have a full-blown substance use disorder, they have no power. There's no choice anymore.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of Tale of Two Hygienists, episode number 304. My name is Andrew.
And this is Michelle. I just want to bring up the fact that I think Andrew and I have changed lives. We've had like a body switch, and Andrew's living the life that I used to live, traveling all over the world, our country.
It has been, pretty much just this country so far, but it's been so interesting. And I was... So weird that you brought this up, because I was thinking this too. I travel now with a carry-on and not a checked bag.
Oh.
Do you know what a big deal that is? I don't think our listener friends really understand that.
Well, just to give a little background, we would show up to shows together, and I would have a tiny little carry-on. I would say an expert packer at this point.
Yeah.
And Andrew would show up with a suitcase that could take my body away. And it was so big that I
could put your body one in each side of that suitcase, I think.
Yeah.
One on the top half, one on the bottom half.
Ginormous.
Yes.
Ginormous. And so you were always checking bags, and I was like, I'd sooner wear the same piece of clothing every single day that I'm gone than check a bag.
Yeah. Yeah.
So
and I'm like, well, I can't live without any of this stuff is what I was thinking at the time. And I think part of it's true. And if I have equipment, I still have to check a bag. But now that I'm, traveling for, work or even for fun, it's, I'm just like, dang, okay. I really don't need the things that I once needed.
Man.
And yeah.
Wow. Well, this is a dental show, and these are dental things that we're traveling for, because we were definitely on the road a lot for dentistry.
Mm-hmm. Mm-hmm.
Well, this week's episode, I think, was really good. I wish you could have been on it. When we have these episodes sometimes where it's been a minute since I've talked about substance use, or I would have termed it substance abuse at one point. I'm definitely changing up my my lexicon, I guess, around it. And it's been a while since we've had an episode like this where I was like, oh my gosh, I'm gonna have to really learn new words, and how to approach things differently. It's been a minute.
Well, it feels good though, right? It feels like we're jumping back into the learning part of why we started this in the beginning, right? We want to just teach us all of the new things, everyone. Thank you so much for all that.
Yeah. And I've really had to even do some of my own work around I haven't fully come to a full working point in my head, so it's this message might be a little messy because I'm still working on it. But I know that I've been known for a long time of how much I've enjoyed wine and drinking wine. And, I think in some ways I was being very insensitive to those who might have struggled with some substance use, and alcohol being one of them. And it's been really interesting. And I told you this the other day because I've had to go on this diet because if everybody's been listening, I had this crazy surgery a few years ago. They had to remove a large portion of my intestines. And I am just physically I'm recovered, but like from a gut health standpoint, I am not. And so I'm really trying to work on that. So I've been on this really, what I would deem a sad and unhappy diet of like gluten-free, vegan, pretty much, because I didn't really eat meat prior to this. So vegan, gluten-free, and I was asked to stay off of caffeine and alcohol, and I was like, I'm getting better at it. I'm handling it much better, but in the beginning it was really rough. But so I am having some cheat moments, and some of those will be a glass of wine occasionally. Whereas before, I almost, in a really horrible way, and I know this sounds horrible as I say it, but maybe there'll be other people out there that can resonate with this or even learn from this, but I wore it almost like a badge how much I could tolerate, which is horrible, right? Like, that's not great.
Yes, but that's a learned behavior, though. That is something that you saw somewhere else.
But also, I'm a little petite, tiny human, and so I think I hate being underestimated. And so when people just make, that was just another bucket of assumptions that people made. And I'm like, I got this. Y'all get out of my way. You assume this about me, I'll prove you wrong. Which is, again, this is a very unhealthy side of that. But I now have been, like I said, have like 1 or 2 glasses occasionally, and I truly feel ill the next day, which is insane to me. And now I'm like looking back on how I was able to function drinking a glass of wine or 2 every single night. So this podcast episode is just really, I don't know. It just came at a time where I was like, I'm reassessing a lot of things around alcohol and substance use and just behaviors and learned behaviors and conditioned behaviors. So, I don't know. Like I said, this was just going to be a messy thought process, but this podcast was really
But
really nice.
That's you to a T. If for all of our listener out there that loves us, none of our things really, like at the very beginning, are well thought out, especially on your end. No offense, but also really much on your end. And then you work through it, and then it's this coherent thought, and then you deliver it very well in 3 or 4 weeks from now.
If that. If that. I'll just be pulling these puzzle pieces together to make this thought, and who knows when that actually will become this big picture. Big puzzle that's completed. No,
but it's really, honestly, I give you a lot of crap for it, but that's really brave of you to put yourself out there to the world as you're trying to decipher how you want to say certain messages.
Yeah, I just hope that well, thank you, and I also hope that people aren't in it for one, and they're like, that girl's dumb. I'm like, follow me on my journey.
Yeah, please. Exactly.
But anyway, not to take away from this episode because it was so good. Do you have anything else to say before I throw it to the interview?
Nope.
Okay, good. So you're going to enjoy this episode all around substance use. This was a student roundtable. So we did have real foundational kind of conversation. So enjoy this with Stephanie Botts and Dr. Brett Kessler. Well, welcome everybody to the interview portion of the podcast. This is going to be for the student-focused roundtable. And I'm really excited to talk about a topic that we really haven't broached very much on this podcast, which is a shame. And we're going to be talking about working with our patients who have struggled with substance abuse or are currently struggling with substance abuse. And I have 2 great guests on, Stephanie Botts and Dr. Brett Kessler. Welcome to the podcast.
Hi.
Thanks for having us.
So let's start with Stephanie. Tell us about who you are and why this topic matters to you.
Sure. Yeah. So my name's Stephanie. Like you said, I am a hygienist in Denver, Colorado. I've been practicing for over 13 years. And this topic is very near and dear and personal to me. I've had experience with substance use disorder, and it's definitely very prevalent in my family. And so when you go through something like that, I think it ignites a passion in you to spread the word and try to educate people on this topic as much as possible. So that's why I'm here.
That's awesome. Dr. Kessler?
And hi, I'm Dr. Brett Kessler. I'm a dentist also in Denver, Colorado. And today actually is my 23rd anniversary of getting sober. And it's something that has been, thank you.
Wow.
It's been something that's very important to me, my recovery. And, and I see a lot of my fellow friends in recovery with dental issues. And I think we can provide a unique solution to, or help them with their solution and get them back on track. So it's very important. I'm glad to have this conversation.
Well, thank you. Congratulations. We've also had Dr. Alan Mead on, who's talked about his struggle as well. And I'm so excited and happy for your vulnerability, everyone's vulnerability in this, because I think that's how we really we get some change happening when people don't feel like they're alone. So I want to talk about like diving into some terminology, because am I up to date on my terminology when I say substance abuse? Like, am I correct?
Well, if I can just give you my 2 cents on that, I think that we're trying to get away from like stigmatizing language that can make people who are struggling with substance use disorder or people who are in recovery, we don't want to feel different than everyone else, like we're just like everybody else. So I think that that's why we're maybe moving away from terms like alcoholic or drug addict or even substance abuse. And we want to say things like substance use or substance use disorder, things like that.
Well, thank you for that update. And I'm going to work that into my vernacular, because I don't want to say the wrong things. And I love that it is changing, because there's so many things that are stigmatized around us as human beings, and we know that no one's a bad person that's suffering or struggling with these things. So I almost don't even know what question to ask, because I'm sadly very ignorant. I guess where I could throw out some things is like what I learned in school around being very careful about things that I would give a patient to take home or prescribe. Like what's the new stuff around that? And am I completely so old in that understanding?
Well, first thing, if you have a patient who is in recovery from a substance use disorder, we've got to be careful with prescribing any kind of opiates or any kind of drugs that could be possibly abused. That doesn't mean that they can't have opiates or other drugs to help, like with anxiety and stuff like that, like Valium or Halcion and stuff like that. But we have to be really careful, because it could open up the addiction again. In addition, dentistry is oftentimes the catalyst for the first time use of an opiate, with wisdom teeth extractions. And, a teenager, a lot of times especially addicts, the first time they'll say they ever used was when they got their wisdom teeth out and they got a prescription for Percocet or Vicodin, and, it kind of sent them off to the races. So we got to be real careful with that.
And I think too, with people, it's kind of tough when people haven't had the experience of a substance use disorder yet. But especially people in recovery, they are really open about being in recovery. They don't want to return to use. And they understand that some of these things, like what Dr. Brout just mentioned, or things like nitrous, those can be triggering. And they have a very healthy fear on not wanting to return to use. And so we as dental practitioners, we need to just be educated on that and respect that.
Mm-hmm. Whenever I see a patient who's open about their recovery, we'll have some, very candid conversations, because fear is a big trigger for relapse. And so we want to make sure that they're comfortable. And I always tell patients, some of the treatment we're going to do may cause pain, but that pain will be manageable. It usually lasts 2 or 3 days, but it pales in comparison to the pain of opening up an active addiction again. And as I say that, I could just see the body language of the patient, relax, and I tell them, I'm with you here, and we're going to help manage that pain. We're going to get you through it, and you're going to be able to do it. And it really is a great way to start treatment, as opposed to I've already taken out teeth and they're in so much pain. It's almost like a panic attack, and you can't catch up on that. So I always have that conversation proactively.
I'm just curious about patients seeking care who have substance use disorder or are in recovery because of the fear of needing a narcotic to handle the pain? Is that something that happens?
It's huge. A lot. I mean, because opiate addiction is the addiction du jour right now. So many. And by the way, it was just announced that in the year period from October of last year to October this year, the very most amount of people died of opiate overdoses in the history they've ever been tracking it. And we've been doing so much work to try and curb that and lower it. But with the pandemic, it skyrocketed again, and 94,000 deaths this year of opiate overdoses.
And they're attributing that to the pandemic, right, Dr. Brett?
Yeah. It's the isolation. So it's really scary. So the opiate addicts are like I said before, they're scared of opening up that addiction again because it's so hard to get off opiates. They don't want to go back to that. Yet they also don't want to feel pain when they're going through dental work, but they know they need to have it done. So it's really kind of a quandary they're in. And we have to partner with them and let them know we're not here to hurt them, and we're going to help them through whatever pain they have in a safe way.
And I think too, with the opiate issue, Dr. Brett, I think a lot of patients and maybe clinicians don't realize that alternating, ibuprofen and Tylenol can be just as, or if not more effective than an opiate. So there are solutions for people with substance use disorder. But I personally, I would rather deal with the pain, to be honest with you, than even risk triggering myself or, opening up some opportunity for me to return to use. I have that fear, which I don't think is a bad thing. But yeah, we just need to be mindful of that when we're dealing with patients with substance use disorder.
Yeah. And ibuprofen and Tylenol is more effective than opiates. It's proven time and time again. And, and I let my patients know that up front too. But again, sometimes you need breakthrough, pain management. And so we will prescribe an opiate in that case. There's a societal norm that people are expecting to get an opiate when we take a tooth out or when we do scaling and root planing. We have to just take a stand and, say this is science and this is what's right and this is what's true and this is the least risky and yet very effective.
Yeah. And Dr. Tom Biola, if anybody doesn't know what we're talking about right now, has done quite a few podcasts with us around pain management. So definitely go listen to that with the combination of ibuprofen and Tylenol or acetaminophen. So definitely listen to that. I'm curious though, for let's say we have somebody that's sitting in our chair, especially our students that we're really kind of talking to today, and they haven't had experience with anybody that is, going through substance use at the moment. Are there any things that identifiers, things that we should be aware of, behaviors, and then how do we have that conversation, or is it even our place?
Well, I personally think it is our place. We're healthcare professionals. That's what we do. And substance use, no matter what form it's in, has detrimental effects on the health of the body and the mouth. And so I think that it is under our umbrella of things that we should be screening for. And I think it's an easy way that I have found to be non-confrontational about asking about substance use disorder is just making sure it's on the medical history, so that they can freely answer as far as if they use and how much they use. And then I always ask about substance use when I'm doing oral cancer screenings. That's a really good opportunity to start initiating that conversation, because especially with alcohol, it's one of the leading causes of oral cancer. So we're very comfortable talking about tobacco, but not so much alcohol. And we shouldn't be uncomfortable talking about that, because that definitely is a risk factor for oral cancer.
Yeah. And so obviously we want to, work on patients when they're sober and lucid. And sometimes you can't tell. A telltale sign for an opiate, someone who's on opiates, is their pupils will be like pinpoints, and you can see that. If they're on meth or cocaine, their pupils are wide open. And if you take the light and just kind of accidentally on purpose, put the light a little bit too high into their eyes, they will, cringe from it like a vampire, towards sunlight. So that's a good way to tell. And I also, when I'm doing the oral cancer screening, I'm feeling the sternocleidomastoids. I'll ask my patients to use any tobacco, marijuana, or vaping products. We're in Colorado, and I'm always surprised who says yes to all of those. Yeah. And there's no stereotypical marijuana smoker. There's no stereotypical vapor now. And so that opens up the opportunity when they say yes, it opens up the opportunity for us to have a conversation about it. And the marijuana industry has, done very, very well PRing the fact that they think that it cures everything. And in fact, it doesn't cure anything. It may make you feel less anxious. And I'm sure there are some medical, advantages to using it, but they haven't been studied yet. But it burns at a higher temperature than cigarettes do. And there's a lot more carcinogens in there. And so it's causes problems. And I think it's a great opportunity for us to tell our patients that that it potentially could be a problem for them.
And a lot of patients, they have no idea. They have no idea that marijuana increases risk for oral cancer or alcohol. And so at the very least, it's not like we're trying to perform interventions on our patients when they come in or anything. But I think it's important for us to know the science and to educate our patients about it. Because a lot of them, they're like, oh my God, I had no idea that alcohol contributes to oral cancer in that way.
So when we say like alcohol and marijuana, and we know smoking, like these are all things that we know, is the threshold to increase their risk of cancer different for everyone? I mean, if like you're socially drinking 1 or 2 glasses of wine a week versus a daily versus smoking every day versus the occasional, I feel like I should know this, but I do not.
Well, I think the risk increases with the amount of use. Wouldn't you agree, Dr. Brett?
I agree 100%. And, and there's other risk factors too with, HPV and, who knows who's exposed to HPV, who knows if they have it on board already, and you throw in smoking or throw in, drinking. I don't know, the last couple of years, and Stephanie, you've probably seen this too, that I've seen so many people who have oral cancer that aren't the prototypical drinker smokers. Yeah. It's come back in force, and oral cancer, the best treatment for oral cancer is early detection. So we check everybody very carefully, very thoroughly. So, because the treatment of oral cancer is worse than the disease.
Yeah. Yeah.
So
I agree.
Do you have some do's and don'ts of interacting with patients, things that we should say, recommendations we should give? Things that have just gone horribly wrong that we should just never say to a patient that is in recovery or struggling with substance use?
I always try to just be really curious with patients, and I come as far as when I'm talking to them about substance use or like smoking, vaping, alcohol, whatever, I'm just coming from a very scientific, objective point of view. And I'm not telling them what they should or shouldn't do. It's their health, but I'm just trying to educate. And I have had patients who do, say that they drink alcohol, and then I just advise them of the recommended daily limits, because there are recommended daily amounts. And if you exceed those, then that's what puts you at risk. And so it's just more of like an educational standpoint instead of a telling them what they should do standpoint, if that makes sense.
Right. And I do that too. And the beauty of being in the dental field is we get to see our patients over long periods of time, and we see them more than their physicians see them. And so when we notice changes in behaviors, they're showing up late, or we smell alcohol in the breath, or they're, just acting erratic, I have no problem having a conversation with them that starts with the phrase, "I am concerned." Last time you were here, you were acting a little weird, and I smelled alcohol in your breath. It was 9 a.m. And, is there anything going on that I can help you with? If you're drinking in the morning, there's, I just see all sorts of problems here. And I'm pretty open with my recovery to my patients. I don't wear a sign, I'm an addict on my chest, but if it's appropriate, I open up about that. And a lot of times I'll see clenching and grinding, and is there increase in stress in your life? Has something changed? And 6 months later, I've had it happen several times where they've said, I've been struggling with alcohol, and you telling me clenching and grinding, stress, et cetera, was a catalyst to help me get help. And I've never regretted asking a patient if there's something wrong and offering solution. And we've done interventions on patients and got them into treatment. And and they've come back and thanked us, and it's kind of outside the scope of dentistry, but I'll never forget it.
Well, so you're impacting patients' lives, not just their teeth, but their entire life. That's huge.
Right.
And I think what you said about recognizing changes, that's one of the biggest tools that we have, because we are seeing our patients so frequently that we can notice personality changes or changes in appearance or things like that, and kind of start talking to them. But I think a lot of us are scared to start talking about this with our patients. And I totally understand that. But I have not once had a patient be upset that I'm asking these questions. And most patients are relatively open about it.
Yeah. And the key is coming from a non-judgmental perspective.
Yeah.
Starting with, I am concerned, you're with them, you're not judging them, you're not belittling them. No one with a substance use disorder wants to be talked down to at all. Their defenses will get up and you'll never, get through. But, very least we're planting seeds that we're noticing changes, and, they may admit to something, they may not, but they'll start to introspect about it.
Yep. And I think as far as things to avoid, we see this with people who are smokers. Like, it's not really beneficial for us to say you should really quit. Like, they know that they should quit. And people who have substance use disorder, most of them know that there's an issue. So I don't think that that's helpful. But like what Dr. Brett said, coming from a non-judgmental, and then my approach as far as like just coming at it scientifically and just giving them some facts is a lot less judgmental.
Right. And quitting cigarettes is a really tough thing to do. And vaping, substituting for vaping, yes, we're not getting the high heat and the carcinogens, but man, there's other things going on there that we don't even know yet. And they're
getting a hell of a lot more nicotine usually with vaping. It's crazy.
It's nuts. And they're the best. And I have this conversation too about that, if they're smoking or vaping. And I ask them, I tell them, the biggest cause of tooth loss is tobacco use or nicotine use. And so, you're here because you want to maintain your teeth for the rest of your life, and this is a big risk factor. And so how are you doing with that? And they always say, I know I should quit. And I always say then the next thing I say is the best way to quit is to keep trying to quit, because it is so hard to quit, And so we don't prescribe, any kind of drugs for helping with the craving and stuff like that. But I suggest they see their doctor to help with that. There's a very strong antidepressant factor in nicotine. And when you take away the nicotine, they lose that antidepressive, and they can then go into, depressive episodes and things like that. And that can be relieved really quick with one cigarette or one hit of the vape. So it's very, very tough. And so we just always want to partner with them and say, just keep quitting and we'll help you. We're cheering for you. We're hoping for you. So.
Yeah, I really like that, Dr. Brett. I haven't heard that before. I think I'm going to steal it.
Absolutely. Yeah. That's everybody on this podcast. Steal it. Take it. Partner with your patients.
Yes,
keep quitting.
And if anyone is interested in understanding the nicotine connection a little bit better, you can go listen to Dr. Stasha Gomanek talking about that in one of her episodes. It was really something fascinating that I learned. And so, there's always these moments where, like, I know what I know now. I wish I could have approached a patient, 10 years ago, a little bit different, because I have this knowledge. The knowledge that I have now is centered around motivational interviewing. And I know that that's been a huge thing in substance use and helping people get into recovery. And we're using it and we're hearing people use it a lot more in dentistry. And I guess my ultimate question with this is because with my patient at the time, she was definitely struggling with depression. Like I could see it. She was coming on almost a monthly basis. I always worked in perio. So these people were like more frequented with their treatment. And I could see when she would come in and she was having these really hard bouts of depression, and she would drink a little bit more. She made me drink right after work and just like sleep in the chair and then just like not brush her teeth at night. And in my mind then, with, my ignorant like approach to patient care, or my taught approach of the clinician's the expert, you're here for my expertise, listen to me. I was like, well, you just got to do it. You just got to get up and you just got to brush your teeth. And I was like, God, Michelle. It was like some of the worst things I've ever said to a patient. Like she's struggling and you're just being like, girl, just do it. What the hell? Like, what are you doing? So I wish at the time, I had a recommendation for her as far as like a mental health expert or a clinic to send her, or a psychologist. Because we talk about this a lot of like, have an ENT to recommend them to, have a sleep specialist to send them to if that's not what you're practicing in your office. So how do you guys feel? And do you have connections with local people that can help get people into recovery or who are struggling with depression at the moment?
Okay, I guess I'll take this one. Yes. Yes, there's a treatment center, several treatment centers in the Denver area that I affiliate with, and also addiction medicine doctors, therapists. And, it's really good as a dental office to have referrals for all things medical, because we are healthcare providers, and even though we are on a different insurance platform than medical, the mouth is still connected, and we are, the teeth that come in are attached to somebody, and we have to treat that somebody. Going back to your motivational interviewing comment, hygienists are masters at motivational interviewing. I can't tell you how many times I smiled listening to Stephanie in the next room talking to patients about things that sometimes have to do with flossing, sometimes have to do with nutrition, sometimes have to do with wellness and exercise. And I mean, if you guys can get people to floss on a regular basis, you can have this conversation about substance abuse. You're masters at it. And I think it's one of the beauties, because you get to spend an hour with your patient on a regular basis, and they really develop that trust and connection with you. I'm in there, I'm just in there for a few minutes, I'm drilling and I'm out of there. But, the hygienists have this awesome opportunity to help that patient's trajectory change to the good. Depression is a brain disease. Addiction is a brain disease, and you can't you can't logic your way out of the brain disease. And patients are ready when they're ready. And I think the best thing you could do, like I said before, is just make sure they know you care about them, and you're going to partner with them to lead them to the good side. And in the meantime, you do the best you can with what you got.
Yeah, I thank you, Dr. Brett, for supporting us hygienists. Michelle, he's always been like hygienist's biggest fan. So, and we used to work together. I don't know if you knew that, but anyways, yeah. But I think something that Dr. Brett mentioned, and you mentioned too, any kind of substance use is a mental disorder or an illness, and it's not so simple as the person just not drinking or not smoking or not using it. Typically, when they have a full-blown substance use disorder, they have no power. There's no choice anymore. They have to do it. And so it's not like they don't want to be using. They don't want, it's not like they're just like these lazy losers at home who just want to use all the time. That's not what it's like. But once you develop that addiction, it takes a lot to overcome that. It's not so simple as just stopping, just deciding to stop.
I'm curious if there are resources for us. Well, I guess let me take one step back, because I'm just curious, like, when you do make that recommendation or you notice these things and you start having this conversation with patients, like, I've noticed some changes, like you were acting a little different. I have seen you for years. Like, is everything okay? I mean, is that how you start making that conversation and moving towards like, I think you could, benefit from talking to somebody or getting some kind of treatment? Because I mean, I don't know, like how do you feel about the stigma around mental health issues and substance use? Like, are they pretty equally just horribly stigmatized? Or because I would imagine that's a struggle for a patient too. Now they have two things that they have to go deal with that are stigmatized.
Well, a lot of times people are using because of an underlying mental health issue. So they're definitely linked, and it's just unfortunate that there is such a stigma for both. I was hoping that with the pandemic, that stigma would be reduced, because a lot of people, if they didn't have anxiety or depression before, they certainly have it now and they understand. So I was hoping that, some of that stigma would be reduced.
Yeah, and it's unfortunate, because in my own personal story, I mean, I drank, I smoked pot, but my drug use just escalated to a level, and I crossed over this line, and I still did really well in dental school. I was a full-blown alcoholic while I was in dental school, but I still graduated really high in my class, and I performed really well. And but the bottom line is, when I put something in my body, this craving would kick in, and I'd be off to the races, and I couldn't stop. And I'm smart, and I don't look like a drug addict. I don't look like an alcoholic, but my brain changed, and there's a genetic predisposition towards it, and then an environmental factor, and I didn't grow up wanting to be this, but I am, and so I do things for it on a daily basis. The stigma is because not enough people who are in recovery stand up and talk about how great recovery is. There's so much shame and humiliation that's affiliated with it. So, we feel like we failed, and society doesn't help by putting, extra stigma on us. So, I share because it's the best thing that's ever happened to me. And I share that with my patients that way too. Back to motivational interviewing, just asking questions is the way in. It really is. Mm-hmm. If you tell them you need to floss, they're not gonna listen if they've got other things on their mind. And the bottom line with mental health, you can't fix your broken brain with your own broken brain. We need to ask for help, and you need to get professional help. There's people in recovery in everybody's practice, and if they're in recovery, they're going to be open about being in recovery. And I know from my own history that patients who are in recovery want to be a resource. And so if I've got another patient who's hurting or who's struggling with substance abuse disorder, those other patients in recovery are happy to field phone calls from those people. It's like we don't kill our wounded. We want to, heal them up and get them back onto a productive life. So there's resources everywhere, and but you can't do it alone. That's when people die, and that's not right.
And I think what you said too about you not necessarily looking like an alcoholic, or whatever preconceived notion we have in our head of what alcoholics look like. But that's so true. There's a lot of people, myself included, very high functioning, very accomplished, but you never know like what's going on behind closed doors. And so it's just good to kind of throw those preconceived notions out the window, because they really, substance use disorder has no preference. It affects everyone on every level in a different way,
including dentists and hygienists. And so I do have to put a plug in that, substance abuse disorder affects 10 to 15% of the population, the human population. And sometimes dentists and hygienists consider themselves human. So we are affected and to that. And, and every state has a wellness program that can offer resources to us professionals and help us get help with dignity if needed.
Mm. So I would love to close it out with maybe some resources and education for patients. And then if you have any that we could offer patients, if or I mean, if there's hotlines or what is out there for us and for our patients?
So I'm on the board of trustees of the American Dental Association, and I represent 7 states out here in the Southwest. And all through my recovery, I've been involved with the dental well-being program with the American Dental Association. So ADA website has some resources for people to explore anonymously, both patients and practitioners. And every state dental association also has a part of their website to access as well. The other thing is, treatment centers are online. 12-step groups are easy to find online. Recovery groups, many paths to recovery. And like I said, to generate a referral group of professionals within your neighborhood is I think a key to having a really successful practice that will help enhance the overall health of your patients, not just mental health resources, but physical health resources and medical resources and things like that.
Yeah, I think it's key to be familiar with what's available in your community and just have those resources ready for when you have a conversation with the patient and they want to explore that issue further. I also recommend there's some online assessments, like questionnaires that patients or practitioners can go on and fill out to see if maybe they have a problem with substances or not. So I feel I have found that that's really useful. And another thing that can be useful for us as far as getting comfortable having these conversations is expert training. And that really helps. There's a lot of free trainings online that you can take, but it helps you be more comfortable having that conversation with the patient and kind of develop those motivational interviewing skills too.
So SBIRT is screening, brief intervention, refer to treatment. And it's a technique that is very effective with the use of motivational interviewing to get people to change. And SBIRT is specific around alcohol and drug use. Thank
you for that. Oh, wow. I feel like I need to go do my own education because this is all very new to me. So I really do appreciate both of your time today and all your expertise and knowledge around this and being open and vulnerable to have this conversation with us. If people want to have take a course from you or have follow-up questions, how could they learn more from you?
So I'm not really lecturing on this right now because I'm pretty busy with my ADA commitments. I'm not sure if Stephanie is, but I'm always available, either cell phone or email, and I'm happy to share that on the show notes. So
yep,
I field about 3 or 4 phone calls a month from people around the country who are questioning substance abuse issues outside of the practice. So these are professionals, looking for help.
Yeah, and I'll put my information in the show notes too. I do lecture about this, and I am, of course, open for anyone who has any questions about it or who just wants to talk about it or wants some training. So I'm very open, and I really appreciate, Michelle, that you're talking about this.
Big time.
I think that the more education that we can get out there and the more awareness we can get out there, it's really going to help reduce the stigma that we were talking about.
Big time.
Well, thank you. It's an honor. It's an honor to have you both on and having this important conversation. Again, thank you for your time.
Thank you, Michelle.
Awesome. Thanks, Michelle.